the Honorable Dr. Fenton Ferguson, Minister of Health, Consul General of Jamaica to Toronto, Mr. Seth George Ramakan, President of the Jamaican Diaspora Canada Foundation, Ms. Valerie Steele, community leaders, distinguished guests, ladies and gentlemen, good evening.
Good evening.
We are very proud to welcome the Minister and his delegation to Toronto. And I must say, I was talking to some of the members of the delegation, and this is their first time in Canada. And we like to think of Toronto as the center of the universe. So once you've hit Toronto, you've pretty much seen it all. So on behalf of the Board of Directors, the members and the staff of this fine organization, I want to welcome you. The JCA is 51 years old. So we're the same age as when Jamaica got its independence. That's something that we're very, very proud of. And as we entertain you here at the Jamaican Canadian Center, which is owned and operated by the JCA. So we own the building, so we control things in here. We've hosted prime ministers, both Canadian and Jamaican. We have hosted Usain Bolt. We have hosted a couple of the Olympians, actually. So by having you here, Minister, you've completed the circle as far as we're concerned. So we are looking forward to hearing the message that you're bringing this evening. The things that are taking place in Jamaica in terms of healthcare, in my opinion, is incredible. There are so many initiatives going on right now. We had Dr. Upton Allen here to speak to the members of JCA when he was introducing the fundraiser, in the initiative in bringing pediatric oncologists into the Caribbean. I didn't realize there were not any pediatric oncologists within the Caribbean region. So when a child gets cancer in the islands, their survival rate is about 20%. When a child in Toronto gets cancer, the survival rate is 80 to 90%. The first oncologist, pediatric oncologist, is now residing in Jamaica, the only one in this region. So all the other islands are coming to us. Ladies and gentlemen, we're making advances. So, Minister, no long talking from me this evening. I want to be in the audience listening to what you're bringing, the synergies that are taking place between Canada, through the JDCF, and through the Jamaican government. So welcome again, enjoy the city, and enjoy the JCA, which is our little Jamaica in Canada. Thank you.
Distinguished ladies and gentlemen, it is my privilege and honor to introduce you to an illustrious team of people that are here with Minister Ferguson. These people are the people with whom we interface in Jamaica. As you know, the Jamaican Diaspora has partnered with the Ministry of Health to assist in upgrading health care services in Jamaica to first world standards by 2030. And in order to do that effectively, some structural changes were made within the ministry and a secretariat was created. With us this evening we have the head honcho of the Ministry of Health from the bureaucratic side, Dr. Jean Dixon, Permanent Secretary in the Ministry of Health. And to my left, to her right, is Ms. Avagate Timberlake, Director of International Cooperation in Health, and she is the go-to person from the diaspora. That's the direct contact link with the diaspora health sector, whether it is from us here in Canada, in the United States, or in UK. Avagate Timberlake is the one we go to first. And if we were to try to get above there, we would be directed back to Miss Timberlake. So join me in welcoming her. Dr. Tamu Davidson, another of the stalwarts in the ministry. Mr. Everton Anderson, who is the CEO of the National Health Fund. Not a ministry employee, but is the CEO of the National Health Fund, and so he funds national health issues. So that's a good partner to have, and we're glad to have him here because we have some real important initiatives to undertake to improve health, and his support will be required. We have with us Dr. Patrick Roberts. Oh, sorry, my apologies. Yes, but Dr. Patrick Roberts is a member of the delegation. He was trained at University of Toronto. He's no stranger to Toronto, and under by Dr. Andy Smith. Now, this Dr. Andy Smith, of whom I refer, he is a chair of surgery at University of Toronto, and until June 14th, he was the head of the cancer care program at Sunnybrook Health Sciences Center and head of the Odette Cancer Treatment Center. And so Dr. Patrick Roberts studied under him there, and he is now the only oncologist surgeon in Jamaica and one of two in the entire West Indies. Let's give a big hand for Dr. Roberts in absentia. We have also Ms. Paulette Mitchell, who is from the Chase Fund. And like Mr. Anderson, her partnership is extremely valuable to this mission because this mission is about business. So ladies and gentlemen, a round of applause for them all collectively. Thank you.
Today is a very exciting day for us here in Toronto, and we are so blessed to have with us the Honorable Minister of Health, the Honorable Fenton Ferguson, who has been here for the past 4 days, and he is going to tell you, I'm sure, of some of the things that he has been accomplishing. But what I would like to do, just by way of remarks, is to give high recognition and praise to you, the Jamaican Canadian diaspora, that is doing what I think is an exceptional job in keeping Jamaica alive in Canada, particularly here in Toronto, with the multiplicity of works and events and all the things that you are doing. It is really wonderful. And the reason the minister is here is because of some significant work done by the Jamaica Diaspora Canada Foundation leadership and its team, which he will tell you about. But I just want to say that the work that is being done is of tremendous support to Jamaica. The Jamaican diaspora is a very critical pillar in the government's program for development. And of course, as the government of Jamaica seeks to lift the profile of Jamaica to become a first world nation. You are very, very important to this. And that is why the minister is here today, and that is why we've taken the time out to spend some time talking with you. So this is very valuable time. So my task really is to introduce the minister and to just say a few words about him. Much more could be said than will be said here. But the Honorable Dr. Fenton Ferguson became Jamaica's 11th Minister of Health in January 2012. Dr. Ferguson, a dental surgeon for over 33 years in the parish of St. Thomas, was the head dental surgeon in charge of the Ministry of Health's dental health services in St. Thomas from 1978 to 1993. He was educated at, which school do you think? Hold on. You don't have to boast. At the Arden High School in Kingston, so big up for Arden. At Howard University in the USA, where he made the Dean's Honor Roll for 3 consecutive years while pursuing his Bachelor of Science degree in chemistry in 1974. I think that is wonderful. Put your hands together. A man of excellence. Dr. Ferguson also gained a postgraduate degree in 1978, which made him a doctor of dental surgery. Dr. Ferguson was invited to enter representation politics in 1989 and in 1993, and he was elected Member of Parliament for St. Thomas Eastern. He has held the seat for over, 5 consecutive general elections, making him the longest serving Member of Parliament for that constituency. Another round of applause for the man. Dr. Ferguson has held several government positions over the 19 years, namely, he was Parliamentary Secretary in the Ministry of Education, Youth and Culture. He was Minister of State in the Ministry of Agriculture. He was the Minister of State with responsibility for works in the Ministry of Transport. He was Minister of State with responsibility for water in the Ministry of Housing and Transport also. In other words, you're seeing a rounded man in terms of his career as a political representative. He has also served in several other capacities, including chairman of the Human Resource and Social Development Committee of Parliament, member of the National Honors and Awards Committee. So he can tell you the people that here in Canada that have had awards. Now you know one of the gentlemen that was able to take that decision so that you can have awards here in Canada, and a member of the subcommittee of the Cabinet on Infrastructure. Dr. Fenton Ferguson, ladies and gentlemen, is an exceptional leader, politician, and a Minister of Health. I've had the opportunity of being with him over the past 4 days in the mission that he has come here to accomplish along with this distinguished delegation. And I can attest to the fact that not only is he a man with a great passion, a deep commitment for the advancement of Jamaica, but he's a man who makes extraordinary sacrifice to do this. He's a brilliant son of the soil. When you hear him speak, he's a man who is able to defend Jamaica and the policies of the government of Jamaica, and to bring to the table the kind of earth-shaking ideas that can bring about the type of change that Jamaica needs today. I believe, ladies and gentlemen, that Jamaica's health is safe in the hands of Dr. Fenton Ferguson. And I have great pleasure in asking him to come to the podium to address you and to share with you whatever is on his mind. Thank you so much.
Madam Chair Valerie Steele, President of the Diaspora Foundation, our distinguished President of the JCA, Audrey Campbell, and members of the Executive Committee. I see a number of old-time friends, but I want to recognize Alvin Curlin, former Speaker, and his brother present here, my good friend Joseph Alsted, former Commissioner with responsibility for economic development, culture, and tourism for the city of Toronto. I see Dan Williamson, who has been a constant person for St. Thomas for many years. Even when I was just member of Parliament, we would work together to keep that ophthalmology clinic going in St. Thomas. And we're very happy to see Dan here this evening, and we continue to look forward to your mission coming to St. Thomas. I see Colleen All, childhood friend, present here this evening, and I want to also recognize distinguished Jamaican and friends of Jamaica who are present here this evening. I want to recognize members of my delegation, my permanent secretary, and others who have been identified already. I really want to recognize you. The Council General, we have had all week of activities, and I really too want to express my thanks to him and to say that Jamaica has an excellent Council General in Toronto. He has demonstrated that right now. And I surely will report. His reputation preceded him. When I got here, I knew of him, but I have now experienced working with him, and I certainly will report to the cabinet of my own findings. But ladies and gentlemen, let me say we are here in your city, and we're here as part of an invitation with the Diaspora Foundation. Oh, Kingsley, busy with his camera. I miss Kingsley. But the diaspora as a movement have done tremendous work to advance the cause of Jamaica. And we are here visiting Sunnybrook, Princess Margaret Cancer Center, and tomorrow we'll go to Sick Kids. But the experience thus far, excellent experience. We are better for having come. What we have done in 2 days will bring tremendous value to the health sector in Jamaica. Today we signed a Memorandum of Understanding with Sunnybrook, and we had the opportunity of meeting with critical players for cancer, and that I know will strengthen our program, because cancer is the Big Ideas project in the ministry that I lead. And therefore, these couple of days have been very, very rewarding. All of us are fired up and ready to go. We return to Jamaica knowing that we have established partnership and friendship that will go down to the greater glory of the people of Jamaica. But let me say, ladies and gentlemen, even as my presentation will be focused on health, I believe that as a cabinet minister, it is my duty to make mention of a few other things. Because the truth is, sometimes politicians come and they tell you of the glorious things and that all is well in Jamaica. Let me be that exception. I want to say that for Jamaica today, we are in a special period. We are operating in a special period. We are operating in a period where there is an agreement with the International Monetary Fund. A period that, with that agreement, there are conditionalities. We're operating against the background of an agreement which speaks to ministry-specific programs. So you understand, if you get an examination, there was a time when you could get an examination and you do well in, well, let us say it's 14 ministry. You do well in 13 subjects, but you fail one and you still pass the test. The IMS is not like that. You have to pass all. Every ministry has targets that you must fulfill. And so with that, with the best intention, there are difficult times. There are difficult times as it relates to employment, because although we are creating new jobs, there are also more persons coming out seeking jobs. And so you're seeing it now in the indicators for employment or for unemployment. And that becomes a challenge, because in a real way, no government wants to see your unemployment figures moving up. But I believe that in spite of the unemployment figures, in spite of the limited fiscal space, because there are ministries that have money, but by virtue of the limited fiscal space, there are projects that you cannot undertake. So that is also a part of the problem. While this is taking place, we are also facing a creeping devaluation of the Jamaican dollar. Greater strength for you from Canada or United States, because our dollar is now 100 and something to 1 in terms of US. So your strength of your dollar is greater, but our capacity at home, there are serious constraints. And therefore, we have to see it in the context of this period. We have to see it in the context of the sacrifices that we must continue to make during this period. Sadly, oftentimes it is the most vulnerable that becomes most affected in periods such as this. The program, as prescribed, have taken all the precaution to protect the most vulnerable, whether it is in health, education, or other forms of social service or services. But in spite of that, the difficulties are there. We are in a period now where there's back to school preparation. So you can imagine the challenges, again, for many families. And I continue to be of the view that education remains the greatest force for social mobility. As a member of parliament, I have for 20 years now, member of parliament, my priority has always been education. Education first, second, third. Because I believe that it is the greatest opportunity for empowerment, especially for the children of the poor. But now, faced with the issues, I could not in good judgment tell you that there are not many families looking to September morning with great trepidation, because it is not easy for many families. But I say to you in the diaspora, you have families too back home. And as you continue the sacrifices that you too have been making, the remittances continue to be a major contributor to our national economy. But you have family members back home in Jamaica. It would be a great treat if we could take decisions about sending something for someone, even to help with back to school. Because while you could send to go to the hairdresser, or you could send to buy a new this, or you could send down some sneakers, I think the sacrifice of sending to help with back to school could make a difference. The sacrifice of adopting a little youngster, especially urban or rural community, would make a difference. And so I make a special appeal against that background. But ladies and gentlemen, even as we bemoan the issues, there are some positive signs. Agriculture is showing growth, and we expect that growth to continue. The fact is that agriculture will always perform as long as we have reasonable weather. Sometimes acts of man in terms of Frida Larson also mitigate against the good fortunes of the farmer. But as it is now, we are seeing some growth in agriculture. There are some challenges, but we are seeing in the last year some growth in agriculture. We are seeing some bright signs also in relation to industry and commerce. I know Minister Hilton will be visiting with you shortly, or Minister Omar Davies, who have the responsibility for the logistic hub. And we are looking forward with great anticipation in relation to the possibilities for Jamaica becoming the fourth node or hub across the globe as it relates to a logistic hub. The possibilities are far-reaching. A lot of work is being undertaken as we speak. And I know my own parish, St. Thomas, will benefit from the dry dock that will be established. And I know St. Thomas man Cameron sitting in the audience, I know he'll be happy to hear that. But the truth is, ladies and gentlemen, across the country, Burnham Field, the Caymanas Economic Zone, we just signed off on some technical arrangements for the Caymanas Economic Zone. So I look forward to those jobs that will be generated from the logistic hub that I find to be uplifting. Minister Paul Webb, as the Minister for Energy and also Technology and Mining, there are a number of positive things on the horizon. Jamaica working with, I think it's Japan, in terms of the rare earth metal that has much greater value than our bauxite. And that is a great possibility for Jamaica. We're working through Minister Paulwell. The price of calls, cellular calls, are going down. And only recently he announced that roaming in the Caribbean and other places will now be just like making a local call. So that's also a major achievement. In relation to rural electrification, which is a big factor for many who are from rural Jamaica, you remember very well some of the older folks, when there was no light, persons have to be using candle, tin lamp, and that kind of thing. We are moving now. Jamaica has over 90% coverage in relation to rural electrification or the rural electrification program. So we are moving also in the right direction where that is concerned. And I know that with all of that, Jamaica will be better for that. But ladies and gentlemen, even as we celebrated with you are celebrating your 51st Jamaica. Only recently we celebrated Emancipendence, and we had an excellent time. We saw the best of Jamaica in terms of our cultural talent, and we were able to bring back the good old-time Jamaica. We also came out in recent times and we saw our athletes on the world stage. And when we look at Jamaica, a small island developing state, being able to produce female 100 meters, 200 meters, 4x1. Male 100 meters, 200 meters, 4x1. And in all of that mix, we also saw that young Calabar student running the fourth leg of the 4x4. 18-year-old boy running under 45, 44, got the baton in 5th place. And Jamaica won the silver. That represents, ladies and gentlemen, the best of what Jamaica can do. The best of what we can do. And so, ladies and gentlemen, the feeling, mixed feeling, constraints, pressures, but we are equal to the task. I think one of the things we know about Jamaicans is that no matter how tough it is, we have always put our best forward. I remember the days as a student at Howard. Those were not the greatest days. I was driving taxi. I remember many nights when you would be studying and you open the fridge and you see that it's empty. And you go back and you continue study and you go back again and open. Right? With the hope that something would happen. Those are the days. I went back to Washington last year and I had to take a cab to Capitol Hill. As a student, I drove taxi. And those are the days when you would drive a taxi and you pick up a congressman, and as a student, you would talk the best talk to ensure you get a good tip. And I, after 30 odd years, returning to Washington in a new capacity, being driven, taking a taxi to Washington to enter Capitol Hill for the first time in my life. I would not have had that privilege 35 years before. I say this, ladies and gentlemen, to show the kind of, when you have to make sacrifice sometimes, and you get the results in the final analysis, those days become good experience. And it helps to toughen you, especially as politicians, to understand what life is about. I remember my little television. It was a closed hanger that was the antenna. You remember that very well. What is happening in relation to the health sector? The Jamaican health sector today, it's structured around regional health authorities. There are 4 regional health authorities and the Ministry of Health. Each authority has a board that governs. Outside of that, we have about 15,000 employees, the ministry. We work with an annual budget of somewhere in the region of 35 billion Jamaican dollars, 32 of which goes into recurrent expenditure. We have a network of 24 hospitals and a network of over 320 health centers. But let me just start by saying, with this kind of structure and what and where we have moved from, many, many years ago, 1940s, 50s, into the 60s, we would have had a significant number of communicable diseases, those we catch. And persons were dying from things like malaria and yellow fever, whooping cough and cholera, etc. We have, in spite of what we now spend for health, we have seen Jamaica moving away from those communicable diseases. We have been able to use our immunization program. Jamaica has won several prizes for performance relative to immunization. And we have been on top of those communicable diseases. We now move into an era where we have a preponderance of non-communicable diseases, namely the high blood pressure, the diabetes, the cancers, etc., the asthmas. And therefore, even with us spending almost $150 per capita, we are getting a life expectancy outcome average of 73. That is comparable with countries like the United States, spending over $5,000. Many of because of the network of health centers, primary care has been at the heart of our success story, because they are spread right across the country. And with that, you now would have had that network of clinics. We're not saying that those clinics were always well stocked. No, we have shortage of medication. over the years, we have challenged with gaps in terms of human resource. But we have been able, with that model, as far back as 1978, when Jamaica went to the Alma Ata conference in the Soviet Union, Jamaica was the lead country in those discussions about primary care. Now we are seeing some of the big developed countries, they're not calling it primary care, they're calling it ambulatory and some other things. But the truth is that we were the leaders. Today, we find ourselves trying to deal with the non-communicable diseases as a major epidemic. Jamaica was instrumental at the World Health Assembly last year. I led a delegation, and we were instrumental in the resolution that spoke to moving to get the decrease by 25% the number of avoidable deaths due to the NCDs by 25% by 2025. Jamaica was party to that. And even as we speak, we have developed a national strategic plan 2013 to 18 in relation to the non-communicable diseases. We have worked also, in my opening remarks, I spoke to cancer being the Big Ideas project. We have now moved to develop also a strategic plan 2013 to 18 for cancer control. And if any of you have had any family member in Jamaica, or I would say even in Canada, that have had, well, Canada is not that based on your system, but in Jamaica, if you had, say, breast cancer, and you had to take a particular drug known as Herceptin. Herceptin, one dose would be running you over $200,000 Jamaican. And you have to take 18 doses. So you're running almost $4 million right up front. And if you had to get radiation therapy, that in the private sector could run you an additional $1.5, $1.7 million. So it wipes out pension funds, it wipes out family savings just by one member. In a sense, one member could have cancer and you are plunged below the poverty line. And that is why I took the decision with my team for us to work to make cancer care the Big Ideas project. And I can tell you, ladies and gentlemen, that since those announcements, the cancer care programs are getting legs. We are making tremendous gains. That is why we are here. And we are seeing now, we still operate for radiation using two cobalt-60 machines, two old cobalt-60 machines. That's obsolete technology. We're moving now towards buying or getting into some kind of arrangement to get two linear or linear accelerator machines, state of the art. Within the next 15 months, I can assure you that Jamaica will have two linear machines that will improve the quality of care for people in Jamaica. But we are seeing cancer not just in relation to chemo and radiation. We're seeing it in the context of screening, early detection, diagnosis, treatment, rehabilitation, and palliative care. We're seeing it right along the continuum. Because unless you begin to develop that kind of system, cervical cancer now, going forward, can be avoided. We have the HPV vaccine. It's expensive. But then life versus expense, as a government, we're going to have to take a tough decision. We're going to have to take tough decisions. And a number of things are coming that we will be able to work towards over time, the elimination of cervical cancer. But we are working in the sense, presently breast cancer remains the number one in relation to Jamaica. Prostate for Jamaican men per capita, Jamaica is the highest level in the world. And therefore, these are areas that we must work. But as we look at the NCDs, we are looking at the NCDs against the background of the risk factors. What are the fundamental risk factors? Proper diet, excessive use of alcohol or harmful use of alcohol, physical inactivity. But the worst among them is tobacco use. The worst among them. And this is why, ladies and gentlemen, on the 15th of July, I lead in the process, but the administration and my team, we took a decision to ban smoking in specified public places. I am getting some, yes, but it is not in times of peace that leadership is tested. Leadership is tested when the going gets tough. Mother taught me, definitely. And I'm equal to the task. We have made some adjustments, and the adjustments we have made is in relation to having shot the system initially, because when some of them, persons see the fine up to 50,000, and when you get to third offense, 12-month imprisonment, shot the system. So the conversation was on a tweet, Facebook, everything. So now we have picked up from the survey, 97% of the population from that survey is aware of the regulations. But in spite of the kickback, 83% of the population supports me. 83. So what I'm saying, ladies and gentlemen, that there is that silent majority. When you hear many of the voices out there, those are the voices of the cigarette industry. Those are the voices of carriers. Those are the voices of British American tobacco in England. But they come almost in a kind of innocent way. But I did a lot of work. Jamaica is the 45th country across the world to have banned smoking in specific public place. The 4th in the Caribbean, following on the footsteps of Trinidad and Tobago, Barbados, and Suriname. The 17th in the Americas. But in spite of that, ladies and gentlemen, the evidence against tobacco, 6 million persons across the globe die annually from tobacco smoking. 600,000 of that number is from second-hand or passive smoking, which is worse than first-hand smoking. Every 6 seconds, someone dies from tobacco-related illness. 1 in 10 adults across the globe die from some kind of tobacco illness. 50% of the 1 billion smokers across the globe will die from some kind of tobacco related illness. 50% of the world 1 billion smokers will die from some kind of tobacco-related illness. But I have said it very clear. My war is not an anti-cigarette or anti-tobacco. That is not just it. My war is a pro-health war. Putting the evidence out there for persons to understand. So even as we have the fines and what will come, I want the people of Jamaica to police these regulations. That you must be able to say to someone, don't pollute my lungs. 71% of all lung cancer across the globe is from tobacco smoking. All of this evidence that is out there for us to understand. So as far as the ministry is concerned, we have been doing some consultation, we're listening, we're making little tweaks, but the fundamental health-related aspect of the regulations, we're not touching it. There will be no retreat or no surrender where that is concerned. And therefore, the tourism industry, I'm meeting with them. And one of the big points initially is that they want me to set up rooms for smoking. Now I just use simple common sense. If I am saying smoking bad, smoking kill, and I am saying passive smoking kill too, and you want me put up a room with 15 or 20 people go inside that. So I bawl out and say, boy, I am not going to set up no death chamber. And I'm vexed. But it's a death chamber because you know our concentration, nicotine, is one of the most dangerous and addictive substances on the planet. So if you understand those fundamentals, then it's not a major thing. So when they're taking me on, nobody taking me on the evidence, you know. Boy, you should have carried to Parliament first. How could I? I know that the industry was given to out there sending things into constituency to fix up this and fix up that. For a year and a half I was talking about tobacco control. So I know I wasn't on a level playing field. And I have the power under Section 15 of the Public Health Act to take this decision. They thought I was coming. So I take the flak. But I know you can't say you're going to war or fight and know that your opponent have the advantage and say, boy, you know, I will just go there and take the leads. It's just, that is common sense too. It's like a man want to fight and him say, come on my backyard. And you gone in there with him. And when you start even a beating, his son come out and his mother come out and his sister. That can't work. So we have to work out in a real way, ladies and gentlemen, how we're going to deal with the realities. I have said it publicly, neither the industry have reacted to it, that the tobacco industry is the only industry I know that kills its best and most loyal and faithful customers. Nobody will say nothing. But it is a fact. Because the more you smoke, the more you kill yourself. And I like to touch the men. Because when I go and I say, well, among the things that it can do, can cause impotence. And you say, some man a jump. But I've been told that in the month or so, a little over a month, some homes are getting better. Ladies are reacting. I have picked up that some people never know that something could happen in the morning. So I believe that we have to do, ladies and gentlemen, what we have to do. But on a serious note, I believe that in spite of the challenge, because we have some challenges in the sector, we still have shortage of manpower, nurses, doctors. We still have shortage of pharmaceuticals, although we have got better. Our budget have increased significantly with the no use of policy. I am of the view, quite frankly, that within another year, because part of this, even this banning of smoking, the fight in terms of the NCD, the smoking ban, we are setting up now 4 centers of excellence at the primary level to show and have a demonstration effect that persons can see what can be offered, that everybody don't want to go to the hospitals, you know, diagnostic care, ambulance, and other things. All of this is part of a greater vision, a vision of a Jamaica in the future that will become the health hub of the Caribbean and the Americas. That is the vision. So it's not just smoking and banning smoking. It's creating a country with a smoke-free environment while you are able to offer quality service at the community level at your clinics, and you have your hospitals now offering the bigger items, which, as you all know, per person, it costs you more to go to hospital than to any center. So you really want to encourage persons. And this is in keeping with the manifesto of the People's National Party, where primary health care is and will be the point of focus. So all of that is tied up in a vision. So it's not a little, you know, a man, an overzealous minister trying to do anything. It is a studied approach, looking forward to that Jamaica. I might not be around to see it, but I know from the smoking alone, in another couple of years, born out of the experience of Northern Ireland and other countries, you'll begin to see less heart attacks. You'll begin to see less strokes. If you look at the developing countries now, you're seeing less of some of these diseases, because the more progressive, like Canada, smoking, they ban smoking in enclosed areas. And when I look, there are people balling about the 5 meter that we are talking about. That's, I go to the hotel I'm staying, it's 30 feet away. Although I still see someone I hook up and do a little thing, but it's 30 feet away. And up to 5,000 Canadian dollars. That's not a little bit of money for cigarette smoking. You understand? In Jamaica, a 20 pack a day is $250,000 a year. That's the economics of it. 20 pack is $250,000 a year. You understand? So you just burn that out. I believe that if we continue on the present path, Jamaica's future in relation to health will be a sound one. I have absolutely no doubt that we are moving in the right direction. The coming out of this week and the discussions, we signed today a MOU, Memorandum of Understanding, with Sunnybrook. We're going to be signing one with Sick Kids tomorrow. I have just set up a think tank and advisory body for the diaspora, because I believe that even as we spend $35 billion in Jamaica for health, there's much more than that out in the diaspora to harness. And what I'm now moving to set up a structured program. Ava Timberlake is the director of the International Corporation on Health. She's a person that relates with permission. Jamaica has an average of 400 missions annually. Last year we had 173. And we are working towards getting structures. I'm a system man, I believe in systems. And once you begin to put systems in place, that is why we are setting up systems of excellence and centers of excellence. All our regional hospitals in due course, we're working towards them becoming centers of excellence. We have challenges with ambulance. We know when I get back, Mr. Anderson, who is the CEO of the National Health Fund, we have 19 ambulances just arrived to be distributed across the hospital system. And we are moving. Last financial year, we spent $375 million improving hospitals. We just broke ground a couple months ago building a female surgical ward for St. Anne's Bay Hospital. When I get back on Friday, I'm going back to break ground for obstetrics and gynecology ward at St. Anne's Bay Hospital. We have done significant work at a Not-to-Be hospital in the post-Sandy period, moving it to carry it into a Type B hospital. We are seeing some changes. It is a work in progress. It is a journey, not a destination. And so we're moving quietly, but we are getting there. I get out here on a Friday, mostly to visit hospitals, health center, firsthand, because as minister, I have a responsibility to know what is happening on the ground. You don't want to stay in office and people tell you about this and tell you about that. But nothing big going to facilitate on the ground. And that is the strategy of this. So I want to say to you, ladies and gentlemen in the diaspora, you have been doing excellent work, both in terms of your personal achievements and in terms of how you have helped Jamaica land here. We appreciate it. We will take it for granted because we know everybody can come back to Jamaica. Don't make no sense either, we don't have enough space. So, make us, you have some people when they come, why you come home next year? They know they're not coming. And they can make a much greater contribution from being here. You understand? Because it is you as the thing that open up this opportunity with Sunnybrook, and that couldn't happen being home. So we have to value being here for those who can return. And I know we have our friend Blondell Evans Reed, who's writing the Going Home or Coming Home book, and I would commend that we all read it. I certainly will read mine. So we want people to come home. And when you come, we want to know you come with consummate ease. You can get the benefits of a returning resident, and so on. But I don't believe people need to have any guilty feeling about being in North America or any other place. Because I went to Malawi. About 4 or 5 weeks ago. And while I'm in the conference, I get in a message to a Jamaican family inviting me to dinner. It's the best food I eat. For the little time I was there. Everywhere across the globe, Jamaican. You go Alaska, you're going to find them. And they are the most. So let us not beat up on ourselves. We have left Jamaica, we come here and we have done well. Many of you have been able to send your children to university. And they have done well. When I look across Jamaica, the US and Canada, it is Jamaicans who are the top leader. Andy Smith, his father is Jamaican from Sunnybrook. He is now the executive vice president and the chief of staff at Sunnybrook, the top man next to the president. And he's the man who is there, love Jamaica. But if you see Andy, you don't know him come from Jamaica. Father must have been a very white man. Then you have Martin Gerbin, good man. He came to Jamaica Friday, flying Friday afternoon, work with us and catch a flight out Friday night to come back up in preparation for this visit. And in 2 days, if you see how the energy, we get a container supposed to move out shortly of medical equipment coming from Sunnybrook. You understand? Let us not devalue your worth in these parts. It is helping Jamaica, and in many regards it is good for Jamaica. And it is this minority in North America, or the minority in Jamaica, that gives Jamaica a bad name. The minority. Jamaicans are good people. Good people by nature. You tell me which other nation our size and population can command that which we have. I mean, going back to the World Games and even the Olympics last year, it comes as if it's a normal thing to have our people just a win and a go on. But it's the world that compete against, you know. They talk about the best in the world, and we know for sure that them going to win. You think that's an easy task? It can't be easy. For you know, say you're going to be competing against the best in the world, and yet we know 1, 2, 3, 1, 2, 4, and all that kind of thing. Look at that little young Weir. Weir was running out of lane 8. That means him not have nobody around down and come second. And him know the only man in the race can beat him is boat. Him know that, you know. So the only man can beat him is boat. That's great, great, great achievement, ladies and gentlemen. So I really want to thank you for the opportunity to address you. I will report faithfully when I get back home, my encounter. And we're going to have to work, whether we are in Jamaica or outside of Jamaica. We're going to have to make Jamaica, in keeping with our national development goals for 2030, we're going to have to make Jamaica the place of choice to live, work, raise our families, and do business. And others are now saying, and also the time. Thank you, ladies and gentlemen. Thank you.